A nose disconcerted ideal is one which is harmonious with the other favorable facial features. Our perception of beauty helps define what makes an ideal shape for a female or male nose. There's always a bit of an artistic element to this, thus the ideal cannot always be boiled down to simple lines or angles and numbers alone. However, artists and plastic surgeons alike can devise some guidelines or proportions that represents the aesthetic ideal by studying beauty and faces that are universally thought to be beautiful. Artists have long made studies of beauty and aesthetic proportions, and today plastic surgeons must similarly understand beauty in order to make change that can enhance their patient's beauty. A patient who comes for a nose operation to our clinic is examined carefully. The photographs are taken, and we use mirror imaging program for the postoperative simulation of the nose. This part of the procedure is very important because, in my opinion, this simulation should be performed with the patient, together with the patient, not on a simple picture sent by an email to us. During this simulation study, other features of the face should also be considered in order to see whether other adjuvant surgeries are needed or not, such as an augmentation rhinoplasty or injection of fat to the lips or the cheeks, or the injection of the fat or the zygoma. For the patients who come to Istanbul for this kind of operations, I prefer to perform the operation next day after I see them at the initial examination. A simple nose operation, which includes the airway problems and aesthetic operation of the nose, takes 1 to 2 hours. All of the preoperative tests are done at the day of the surgery before the operation. And after the operation, it's not uncommon that the patients have some edema and ecchymosis over the eyes. But there will be no pain after the rhinoplasty. The splint over the nose, if there is any, will be removed 3 days after the operation. With the new techniques, it's not needed to keep the splint up to 7 days or 10 days as it's done before. At the 6th day of the operation, the stitches and plasters are removed, and there may be only some slight edema over the face, and the patient is allowed to fly back to his or her country at this day. We can arrange the hotel accommodations and airport, hotel, hospital transfers if it's asked.